Well, hello, family. I know it's been a while since I've been here and get my little champion there. You know, you have to have your little affirmations for yourself. And um, I am combating, they are working on the roof, they are cleaning out the gutters. Why today? I don't know. But that seems to be how my week has been going. I've missed you all. Um, you know, Whenever you step into the caregiving role, and I have a new microphone because I can't seem to find anything around here lately. Um, but I'm gonna persist. I'm gonna continue. I'm gonna get it done because this is a whole part of the caregiving game. I don't know if it's a game, but sometimes it feels like a game. So um, I shared with y'all that I was having some difficulties. It was just a rough day. Well, last week, actually yesterday, well, heck, let's just go on back. Friday, Saturday, Sunday, Monday. Which is one of those days. And so as I started to reflect on some things, I started to have a lot of questions about different things. And I definitely hope this is coming through clear. Y'all know I'm new with this. I was trying to check my mic, do a mic check, but we're going to just roll with it. Maybe you can read my lips. So, um, I was going to finish up today with some valuable resources, and I kept digging and digging, and I kept finding and finding things. So, first off, when I sat down and really took my time to listen and pay attention, it dawned on me that I did put these documents in a different place. Last time I was on, I spoke of the most form, and when we were at the doctor's yesterday, I asked them if this just for North Carolina, and it is. So you'll have to check with your state and see what they have that's close to this. And basically, this is mom's. It's a bright pink, um, and it's the medical orders for scope of treatment. And it says, I'm going to read what this says so you get an idea of it. This is a physician order sheet based on the patient's medical condition and wishes. Any section not completed indicates full treatment for that section. When the need occurs, first follow these orders, then contact physician. So, section A is cardiopulmonary resuscitation. Section B are medical interventions. The patient has a pulse and or is breathing. What are they supposed to do? Are they going to do full comfort treatment, limited additional interventions, and comfort measures? So the first two, it suggests like the person has a pulse and is breathing, and you want to transfer to a hospital if it's indicated. And then the last one, comfort measures, you just want to keep them warm and clean and dry, um, but you are not transferring them to a hospital unless the comfort needs cannot be met in the current location. So it varies. Down in section C, it has antibiotics. Antibiotics, if indicated, determine use or limitation of antibiotics when infection occurs, or no antibiotics. Section D, medically administered fluids and nutrition. Offer oral fluids and nutrition if physically feasible. And then there are varying tiers of treatment for that. And then the final section is discuss with and agreed to and by, and it has a lot of different people: the healthcare agent, the parent or guardian, if the patient is a minor, the patient, so their adult children, it goes on and on. So you can look for something like this in your particular area. And it says at the bottom, send form with patient or resident when transferred or discharged. So it is supposed to stay with the patient so that these medical orders can be met and the scope of treatment that you want for them. I'm looking on the back. It talks about the completion of this. There is no requirement that a patient have a most, but if your loved one has a particular way in which they choose to drop this body or depart this plane, it is best to have something like this written out and it stays with them. Um, the original goes with the patient, and you can't make a copy. Like if you have a copy just to have, you can, but it doesn't hold any weight. All right. Do not alter this form in big letters at the very, very bottom. Okay, so that's that one. The other thing I mentioned was the 5 wishes. And I was like, I know I have this stuff in my bag. And I was laying down, and you know how stuff comes into your head in the middle of the night, partly because I'm always busy during the day doing for everybody else on the phone call, making appointments, canceling appointments, asking questions, doing research, running errands, all that good stuff. Yes. So the 5 wishes. And my mom is visually impaired, so I have to read everything to her. But it says, wish number 1, the person I want to make care decisions for me when I can't, the kind of medical treatment I want or don't want. These are their wishes. Number 3, how comfortable I want to be. Number 4, how I want people to treat me. And then number 5, what I want my loved ones to know. So again, this is a product that's here. It came from a place called Aging with Dignity. Of course, I'll put this in the chat or comments area, but it basically walks through 5 wishes. There are many things in life that are out of our hands. This 5 wishes document gives you a way to control something very important: how you are treated if you get seriously ill. It is an easy to complete form that lets you say exactly what you, this is the loved one, want. Once it's filled out and properly signed, it is valid under the laws of most states. Check with your state. And a lot of this information can be included in different things, will or the living will, the living trust, and things like that. So we did get this completed, my sister and I, as we walk through here. And they also have it online too. 5 wishes. 5 is spelled out. Uh, let's see. 5 Wishes was created with the help of the American Bar Association's Commission on Law and Aging. If you live in the District of Columbia or most states, you can use 5 Wishes and have the peace of mind to know that it substantially meets your state's requirements under the law. If you live in one of 6 states, Indiana, Kansas, New Hampshire, Ohio, Oregon, or Texas, you can still use 5 Wishes, but you may need to take an extra step. And find out more at 5wishes.org. So just FYI. And a lot of this, you're going to see repetition. And the thing is, it's still amazing how many people pass away and they do not have any kind of a plan for them. Other things I want to recommend, and the reason I'm bringing this up, this is a book. Okay, it says my family information that my family needs to know, and it goes through all the different things. My personal information, my emergency contacts, advance directives, medical history, health insurance, healthcare providers, if they have someone coming in and out of the house, or all of the doctors that you go to. I was counting with my mom the other day when we went to her main PCP, primary care physician, and we're going to different places, and I'm getting to the point, and I think this is what tipped me over yesterday, is because we are now with a neurologist, a nephrologist, a endocrinologist, right? Then you go for the test, an ultrasound, an MRI, a PET. Then you have the the test that measures their mental capacity that needs to be taken in certain intervals. So it gets to be a lot. And at some point, you have to just, of course, do we not forget the pharmacy and all the drugs that each one of these individual specialists lays down. And I was sharing with my mom that I have to be very cognizant of the different medications. And y'all know I don't like and don't do medications, but for my mom, um, that's where she is. I did have the luxury of speaking with the gentleman I mentioned to you guys, the prescribing Dr. Canterbury. And while it is costly, it is a wonderful thing, especially if your person, your loved one, and even yourself, uh, if you're taking medications, multiple medications, he will look at and do a consult with you, the medications that you're taking, and he'll ask you, what are your goals? What do you want to do? So I've already started down that path to reach out to a couple of the doctors to ask, what is definitely the need of this, especially, and I'm watching her behaviors. I'm not seeing the um, benefit, basically. And that's a lot more on me to fill the medicine bucket. I call it the bucket with all of her different medications. And then when you run out, you have to keep up with that. And it gets to be a lot, whether you're on through her insurance, where they send medications, that's a 3-month supply. So you're paying for a 3-month supply even though you don't see that exchange of money, if the insurance is covering it, whatever drugs there are, um, if there is a change, if there's a reaction, then you're you have 3 months of supply of a medication that you can't use. Now, I am so bold that I ask for, especially if it's something new, do you have a trial? Give us a trial. I know those pharmacists and the drug reps come in and they give them trials. Ask for a trial. What, they just sitting there? All they can say is no. So, advocate for that. Um, on down, and then I'll get to my funny story. Got medications, financial accounts. How many accounts do you have? Imagine your parents. Now, typically, depending on the age of your parents, they probably had 1 or 2 accounts. But now there are so many different financial institutions to choose from. I know I have several, and I'm beginning to think, okay, passwords to get into that account, um, any codes in, like if I'm doing online banking, then if I go in, you have your card, you have your PIN number, you think of all these different pieces of information just to access your money. So start making a plan, writing it down. And I'll tell you my situation. I'm back to my old phone, y'all. This thing is over 10 years old, about, yes, probably. I had to reactivate it again, or so I thought, because my new phone that I got is not working. And I got the new one in October, and I've been telling them it's not working. And when I have time, not, I have to sit on hold for 45 minutes to an hour, whatever. We'll call you back. And so you start over and over and over to tell your story. So anyway, yeah, last night I was running around, got my phone, I pulled it out. Well, I never looked to see when I charged it up and actually turn it on, I had a PIN number. Do you think I remember this PIN number from October? I tried to let my body do the talking. It didn't work. I couldn't get in it. So luckily, an angel helped me from Spectrum, and he called me at home. He's like, we're not supposed to do this, but I have a phone. This one wasn't working. The other one I had just sent off by UPS, which that was a whole nother thing. So you can imagine I had quite the day. So I got up this morning and the phone isn't working. I called somebody last night, so I know it was working, but all of a sudden it's not working. So that's another thing that I have to go and do. I was hot. I was angry. I was feeling a lot of shame and guilt for going to the doctor's appointment with mom and not being able, not feeling comfortable. This was the first time I have not felt comfortable dealing with her medical care, her medications. For her insulin, they had her on a sliding scale. Well, she's still on it, but like I don't understand it. And when I think I got it, then I'm like, no, and everything. She just got a Dexcom 7. It's a continuous glucose monitoring system. So you wear it for 10 days and you have a little monitor. I had just downloaded that on my new phone. It's not there. So anyway, I say all that to say I felt like yelling. I'm talking to these people on the phone. I could not understand her accent. And I just burst out into tears. And I thought, oh my God, am I having like a nervous breakdown? Like, what's going on? So, that care for yourself is crucial. I thought I had it together, but in light of all that stuff being stacked on top, we went to see the doctor. We had an early appointment, then we had a break. So, we went shopping. Mom wanted some long john under some, underwear, long johns, because it's been cold down here in North Carolina. Go figure. So, we went shopping. That was nice. Um, but then we had two more doctor's appointments in the afternoon, and one was she was supposed to be taking this other mental assessment. If she comes in there, y'all, with a white cane with a red bottom, what's that the universal sign for? I can't see, or I have some visual impairments. Don't slide a piece of paper with small print on it in front of her. So I was like, okay, you must be new because you don't know me. And I told her, I said, she can't fill that out. Oh, well, we'll have to do this later. So we have to make another appointment to come in here to see you again. So you pick up on a lot of the behind the scene things. Now, this is a place where it helps adults, seniors with their Medicare and things like that. Um, but like she didn't fit the script. I'm like, did you not see her come in with the cane? Why are you giving her a piece of paper? Do you know what the white cane means? Yeah. So it was one of those things. And then I had to deal with the phone because the phone's not working, it was muting, and it was just a lot. And so I'm an hour and a half, almost 2 hours at the UPS station. Another thing, they told me, oh, we're going to send you a scan thingy, the barcode. You just go in, you show it to them. Okay, I remember to at least take a picture and show it to him before we got started. And I did write it down, write everything down because can't always remember stuff. Anyway, y'all, the man gave me at the UPS a chair. He gave me water. Um, and I thought it was going to be a quick thing. But at any rate, I went in and he's like, oh, well, we take care of the shipping, but you have to pay to get it packed. I said, I'm not paying you anything. They said, I come here, I show you the code, you take care of everything. So after he heard me going off on the people, he's like, ma'am, I got you. I'll pack up your stuff. I was like, today is not the day you want to work with me. You don't want to cross my path today. So I'm just letting you know or whatever. So anyway, okay, back to where we are. So clearly, I need some support yesterday. But I came home, had a good dinner, went to bed. But again, that's why caregiver support groups are so, so important because one, you can hear other people's stories. So you think you got it bad and you start listening to other people, you'd be like, woo, we sitting pretty right here. So I highly, highly recommend as soon as possible to connect with a caregiver support group. It is invaluable. And then even afterwards, the last care group session that I went to, there were two people in there and their loved ones had passed away. And they were coming for the support of the people that were there. They also wanted to share. They wanted to have some closure. Um, and it makes you think about the things that you still need to take care of in your own family, not just with your loved one, but for yourself too. All right. And it's also for people who are in hospice as well. So I told you all I couldn't remember or find my headsets. I I am a creature of habit, but for whatever reason, I just didn't see it. Now I'm sure as soon as I get off of this, and I procrastinated because I was looking for them, but I'm sure I'll go do something and they'll just pop up out of the craziest place. But anyway, let's continue. Um, the financial accounts, we talked about that before, making sure you get on your loved ones, if it's, a family member, on their financial records and accounts to make sure that when they cannot make decisions, that you are able to step in, because it just changes things when you have to go through like probate or something like that. Okay, remember, I am not a legal representative of anyone. This is the stuff that I found out. And we talked about if they go to different states, you have to have the documentation from different states. Okay, insurance, money that I owe, money owed me, my annuities, my business interests, if they are a entrepreneur or they have a business, my real estate, if they have property, my vehicles, my personal property, jewelry and things like that, my online accounts and password, y'all. Flipping that phone, I had to go to Best Buy to get a factory reset of this phone. And now the thing's still not working. I don't know what's going on with that. But I told them this was my sixth time trying to get um, something resolved. And I told them, you know what? This is my last time attempting this. And if this doesn't work, I'll just involve the news. You know how they have those people? I know in Cleveland, it used to be the Carl Monday or whatever, and they do the Carl Monday report where they go after people, scammers and stuff like that. Or just, they can flex and they can go on behalf of you and others that follow to get some resolution. Um, my memorial instructions. I know this sounds really cruel. This is Lakeview Cemetery in Cleveland, Ohio. Mom's decision is to be cremated. And so this summer we went up there. We had a tour. I never knew all of that about Lakeview Cemetery. It's beautiful, very world well known worldwide. But I got the information. We have ordered her. I know this seems so morbid, but we've ordered her urn, and we've talked through the process by, if she drops her body here in North Carolina, we have a um, funeral home that will handle all of that. And then I guess, would get the remains and take them up to Ohio, to Lakeview. And they even made arrangements to have it documented, get everything documented, that they would set up, how they dress the space where they will place her. Because my dad, his mom, and his father are there in Lakeview Cemetery. So mom, since she will be cremated, will be like at the feet, and you can get a headstone. So like all these things I resisted. I didn't want to do. I didn't want to talk about it, but I said no regrets. I want to be able to celebrate her life when she um, takes her last breath. And I also want these things to be taken care of, so you're not running around like a chicken trying to deal with that. And I learned that from my auntie Mary, um, my mom's oldest sister, who had cancer. She did not tell anyone. She scheduled everything. She even had her programs printed, y'all. I was like, okay, I'm not that organized, but I can look to that and learn. She had her people picked out who was to sing, what songs they were supposed to sing. She had it all laid out. So I can only aspire to something like that. Um, that being said, another resource, okay, a caregiver's guide to dementia. And I've only flipped through here, but it's sort of like what is stress? And then it reads and give you some bullet points too there. It's really not a read cover to cover type book, but you can. And I wanted to say, let's see, the different topics that they talk about are addressing challenging behaviors, because that will come, using use activities in daily care, communicate effectively, make the home safe, like it's going back, right? Support health of the person with dementia, take care of yourself, strategies for specific behaviors like agitation, repeating questions, we're there, inappropriate screaming or crying out or other disruptive sounds. You see people on the street talking to the air or whatever, and then constant arguing or complaining, wandering, restlessness, rummaging, hoarding, refusing or rejecting care, incontinence, behaviors that can be harmful to the self, destroying property, socially inappropriate behavior, sexually inappropriate behavior. It can hit these people in all kinds of ways. Aggressive or combative behaviors, worrying, anxiety, depression, sleep disturbances, and that's when I will give mom those gummy. And it's by Laura Ann Gitlin. She's a PhD, and Catherine Verrier Pearsall. Put it over there. Okay. So, now I'm gonna try something I never did. I'm gonna flip my screen. I hope y'all still be on me. But I was looking up some stuff because mom will sleep a lot, and then nighttime comes and she wants to be up bumping around. Well, that's when I'm trying to get my sleep and my husband. And so um, we try a few things, uh, and don't judge me, y'all, but I've heard that my friends, when their kids are like that, they give them some uh, cough syrup, sleeping medicine, something like that to make them go to sleep. Well, some people like to have a glass of wine or whatever. We I looked up a glass of wine, and I looked up the difference between a glass of wine and a glass of like seltzer with THC or CBD. And um, it says that cannabis use is associated with lower risk of fatty liver disease in people who have used, I hope I don't kick myself out, people who have used cannabis in the past, and people who um, are current users. So this was a study that was done in Hubei, China, and adults with a history of cannabis use are less likely than non-users to be diagnosed with liver steatosis or abnormal fat, according to data published in the Journal of the PLOS 1 plus 1. A group of Chinese investigators assess the relationship between marijuana use and the prevalence of fatty liver disease in a cohort of 2,622 U.S. adults. Study participants consisted of current cannabis consumers, former consumers, and lifetime non users. Researchers determined that both current and former users possessed lower rates of liver steatosis with those did those with no history of marijuana use. Let me read that again. Researchers determined that both current and former users possess lower rates of liver steatosis than did those with no history of marijuana. Okay. So that was one thing I found. And then, like, I was looking up wine. And just so you know, any of the signs of liver damage, and I'm just taking this off Google and other places online, signs and symptoms of liver disease, you might have yellow, that jaundice. Okay, there's a ladder coming down out front. Um, Skin and eyes that appear yellow or jaundice, abdominal pain and swelling, swelling in the legs and the ankles, itchy skin, dark color urine, pale colored stool, chronic fatigue, nausea, vomiting. Those are just to name a few. Okay. So I say that to say is because I found this company that has this seltzer. Um, and so we just take a little bit. She takes a sip or two. She's out. We're not trying to get high. We're just trying to keep her healthy and keep her in a state where her body can get the rest. Because we're dealing with so many metabolic things, we want to make sure her body is resting so that as we start to make these changes, dietary, um, and her physical, her medicines, then her body can start to heal itself, but it has to rest. And that goes for us as the caregiver as well, too. Also, um, earthing and grounding, which is go outside, put your feet on the ground with no shoes on. Our shoes used to be made out of leather, moccasins, um, where it was actual touching the ground, the leather, the membranes. All of our shoes are blown plastic now. One, they're not comfortable, at least to me. They're cute, but they are not comfortable at all. And that rubber keeps us from being in connection with the ground and taking in, it pulls off all the different toxins and the energy we get from the earth, as well as taking the negative energy off of us. So, because that exchange doesn't happen, y'all know my tree, hug a tree self, it builds up in the body. When it builds up in the body, comes out as stress, chronic fatigue, all these different things. And most people go run to the doctor to get a pill from a specialist. So you go into 4 or 5 different specialists, they're going to give you 4 or 5 or more different pills. Ask your doctor if this is right for you. Listen to those commercials. And we go in and say, hey, I want to try this. I want to try this. That may not be the thing for them. But the reason I'm bringing this up is because we are natural beings. I talked about this before. We are batteries and we need to discharge, just like when a thunderstorm and the lightning comes down, that discharge. We need to discharge the things that we're holding on to and take in what the earth wants to give us. All our food comes from the earth, right, y'all? Yes. So we want to get that. And that is how that's one way to start on the path of healing. Now, I am not saying, because I'm not a medical person, don't take your medicine. There are some medicines you need to have, but there are also other alternatives that you can use to help heal yourself. I think I'll do one strictly on just the actual things instead of just talking about them, but we can go through doing some breathing. Okay. I wanted to just share with you. Uh-oh, where'd it go? Tips for people with dementia. And then I think I'm going to wrap this up. Routine, 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 routine. Because of their brain is having some changes, what neural networks were there before are disappearing. Each person has a different rate and it depends on where it is in the brain. And what part of the brain depends on if they're going to have some visual issues, if they're going to have speech issues, if they're going to have emotional issues, hearing issues. It depends on where, if they had a stroke, or where the neural pathways are starting to disintegrate. And because of that, everybody's case is different. Um, but routines, or try to have routines as much as possible. So early on in Alzheimer's, and this is from alzheimers.gov, um, and related dementias, people experience changes in thinking, remembering, reasoning in a way that affects daily life and activities. Eventually, people with these diseases will need more help with simple everyday tasks. Mom asks as soon as she's done eating, "Have we eaten breakfast yet?" That got me yesterday, and I just I went in. I could not in on her, but like with myself, the reality of what we're dealing with here. And I really felt that she had moved to another stage. And that, along with all the other stuff I described before, was really weighing heavy on me yesterday. And I just couldn't seem to get ahead of the game. It happens. I embrace it. I try to learn from it. How do I move on from here? Um, and give yourself some grace. I was feeling very um, not together yesterday. I was feeling very marginalized, and that hurt. That hurt, the fact that, like, I'm feeling out of control. Like, I don't know what I'm doing to help my mom. How that whole put your mask on first. And I had not put my mask on first yesterday, and it was extremely difficult. But I said, this too shall pass, because today all I'm dealing with is the phone again. So, routine. Mom knows when she gets up in the morning, I'll go in, "Hey, how you doing?" I start to take her vitals. Now with this new Dexcom, I'm trying to calibrate them. So I do that. I give her injection. She comes down. I have her pills, always in this blue cup. She knows to, if it's up and it's filled, take your, or has a layer on there of pills. She takes them. When she has taken them, she puts it back on the table upside down. The other day, we were running a little late for an appointment, and she decided she's going to put them in her pocket. Well, I can't rely on her to tell me if she took them or not. Where are the pills? Well, I don't know. Did I take them? I don't know. I stepped out, went to the bathroom. So, did you take them? Well, I can't remember. I put them. And in the beginning of all this, y'all, I really used to think that she was playing. But the more I learn about the degenerative nature of the brain with dementia and the different types of dementia, the more I learn that she's doing the best she can. And no matter what I got going on, she's doing the best she can. Okay. So, this includes bathing. Thank goodness, right now where we are, she can still do that independently. Grooming, and dressing, she has asked me to help her in some areas. It may be upsetting to the person to need help with such personal activities, and it's gonna make a difference. Uh, a daughter dealing with her mother versus a daughter dealing with her dad versus a son dealing with his mother and a son dealing with his dad. So, you know, when I talked about before, who's going to step into that role of caregiver, it's better if it's more than one person, if that's possible, but that's not always possible. So, you know, how are you going to handle these things? And how are your parents going to receive it? Here are a few tips to consider early on. as the disease progresses. Try to keep a routine such as bathing, dressing, eating at the same time each day. I don't have that down pat, but I do have the morning routine down. Help the person write down to-do lists, appointments, and events in a notebook or calendar. I do that. As a matter of fact, I got the idea from when mom was in the hospital. You know how they have the board up in the room as soon as they walk in. Today is, um, and I write the date in multiple ways with numbers and with, January 23rd, 2024. Appointments this week. I put the day and the time and where we're going. Um, And if you teach them that, it becomes a tool for them to go to. Well, she has some visual issues, so I write really big with a bold marker. But um, ideally, that is something where they can learn to go to, like a calendar, like we use our calendar book, um, and it helps to reduce the constant repetition of them asking you the same question. What time are we going? Where are we going? What time is the appointment? Where are we going? Where's the appointment? And it works on you because when you're just trying to have a moment of silence and driving to from appointment to appointment, and it's just, where are we going? Have we been here before? I don't think we've been here before. I'm not sure. That's their brain. That's their brain trying to stay upright because they realize that something is not right, but I got to stay upright. Um, Plan activities that the person enjoys and try to do them at the same time each day. So before I stopped working and people were coming to the house, I would have a puzzle or some games for mom to play, um, and things like that to help her with that memory. She likes to color. I have a big coloring book. I found it at Costco, and she wants to color with it. Uh, that's a challenge because she doesn't like not coloring a nice picture, but I give a lot of praise for that and compliments. Now, consider a system or reminders for helping those who must take medications regularly. I do all that. I sit down like now when she's not here, and I usually fill out 2 to 3, if not 4 weeks in advance, so that if on the fly we have to go, I'm not trying to tote all these bottles with me, but I just dump them. And I have some of the travel ones. I usually have a travel, like a one lister, Monday, Sunday through a Saturday, and I feel one for her morning meds, and then she just takes evening meds. So that's how I organize that. Luckily, she doesn't take anything like 3 times a day. It's usually just a morning and evening. But I have one that's ready to go. If we're running late, I can just grab it and I know, okay, what was in there and not. Oh, while we're on that, you may want to, once I fill the cup, I take a picture of the cup, and I also take a picture of each one of the pills, because if I'm incapacitated, somebody can step in and do with that and make a file, print it off, just like a Google Doc or something, print it off and put it in my notebook that I was telling y'all about, because that's also too, um, especially if you're in between medication changes or something like that, you'll know, okay, this is what it should look like, this is what it now looks like, and this is what it's going to continue to look like until one of those medications changes. Um, Buying loose fitting, comfortable clothes, right? Either just pull up with elastic, because those are easy for them to still be and maintain their independence, versus something with a lot of snaps and buckles and belts and try to keep it simple. Velcro is your friend. Um, we are not here yet, but mom can still get down in the tub, but I'm thinking we're going to need to get one of those shower stools. But this, where we are, width of the uh, tub is so narrow. So, but a shower chair is really good because you, as the caregiver, helping them take a shower, you're not leaning over into it. It's more at a level ergonomically uh, better for your body. And serve meals in a consistent, familiar place. We try to do it here at the table. If we're all going to be in the living room, then we'll all eat in the living room rather than have her sitting here by herself or whatever. I try to sit down with her because that's our time. And she did make a statement one time, well, you're always busy and, I want to sit down with you and eat breakfast. Okay, so we make that happen every morning. Being gentle and respectful. Tell the person what you are going to do step by step while you help them bathe or get dressed, but also in the course of the day. And again, that depends on the person because I can tell her something and she'll turn right around and ask me again. And it does wear on you. You guys have to go to your happy place and smile and say, well, remember, I really try not to say, remember, I took because they can't. That took me a long time to drop from my vocabulary. And it hurts me every time I have to say it because it makes me remember that she can't remember. So that's it for today. But drawing these kinds of things in, letters of instruction, okay, friends and family to be contacted, advisors and other entities to be contacted. In other words, a list of the doctors, a list of your lawyers, a list of anybody involved in things. Location of important documents. If you have a what's the box? The safety deposit box at the bank or whatever, and then the documents location chart, just so that you know where things are. I tell you what, it's a lot. And I've learned a lot by stepping into this role to help my mom. And this is just anything, I mean, uh, you can go online and find these, or you can, based on the information that I was sharing with you, you can create your own. Just start a Google Doc, start putting it in, start pulling those papers, putting them together, deeds, all those important papers that you may need later in life. Start pulling them together in one spot. Y'all, that's all I got. I gave you before the National Institute on Aging. These are some books, Understanding Alzheimer's Disease and, safe use of medications and things like that. And just like with children, you may have to put them up because yesterday, Mom said she took them in a napkin. I've yet to see them, but I have to check her pockets all the time because she loves to chug stuff in them. And so I gave her another set of medicine reluctantly. And then I watched her body because if the medicine is doing what it's supposed to do, her blood pressure was lower, but I made a note of it. But I'm getting to the point where, I can't rely on her word. She can't remember if it happened. And if I didn't see it, I have to go with, well, should I miss this dosage or should I risk giving her a second dosage? So that's why we have the cup thing, and she has to take them at the seat. If we are on the run, like I said, I will grab the strip of medicines and give it to her on the run. Like if we're driving in the car for a distance, I have it on me at all times, and then I can just, okay, we're making a stop, we're going to eat, take your pills, put it back. So you find and figure out your flow. Um, oh, this is what I wanted to share with y'all. Maybe I'll just do this next time. Area agency on aging, and I just want to share these cards. I'll go into this next time. but I mentioned these before. Okay. It's a medical alert card. And this one says, please help. My name is, you put their name on there. I care for a person with dementia. So this would be for me. I put it in my wallet. Please call for help or for someone to help. Okay. So I can use those. And then I was looking for the one that sticks on your car. Okay. A person with dementia lives in this house. We appreciate your patience and compassion. They even have these that I can sort of slip to if we're in the store, mom is acting sort of weird instead of people. You just sort of show this to people. Hey, and I'll sort of do like this to people to let them know. Um, yeah. And then there's stickies that you can stick on your car so that if you are in an accident and the emergency people approach your car, then they can see that this person does not know what's going on and needs some assistance. Yeah, my companion has dementia. Uh-oh. Put it over there. So we apologize if anything said is said or done or surprises or frightens or upsets you. So, you've seen like children in a store. I'm not talking about like the wild, rambunctious children, but I'm talking about people who have some type of mental or physical disability in the store and they're yelling or screaming. And unless you've experienced it and stood in the water, you will never understand it. So I'm going to stop there. I'll go back to the brain donations because then organ donations, I did not get to that, but I really want to keep these smaller and shorter, but it's not happening. Thank y'all for listening. This is therapy beyond what you ever know. For me to just be able to talk and get a lot of this stuff out. I hope you are getting something out of this. Um, yeah, it's a roller coaster ride. Hold on.